Welcome to AUA Leadership in Business, an official podcast of the American Urological Association.
Welcome to the AUA Leadership in Business podcast, where urologic professionals experience the practical application of business acumen essential for success in today's dynamic professional landscape. I'm Dr. Jennifer Miles-Thomas, and in today's episode, we will discuss the power of professional life coaching. Joining me today for this discussion is Dr. Kerri Thurmon. Dr. Thurmon is an associate professor of urology at the University of Colorado. She is also a certified professional life coach. Welcome, Dr. Thurmon.
Thank you so much for having me. I'm very excited to talk about my favorite topic.
Well, I'm excited to hear about it. So, if we just jump right into it, life coaching is a thing now. We hear a lot about it. How did you go through the journey? Like, why did you even decide to become a life coach?
That's such a great question, and it really came from a lot of post-traumatic growth, unfortunately. After my first 2 years of practice, I was really burnt out. And I lost so much empathy for my patients. I was not finding the joy in my job anymore. I went through a really horrible personal tragedy with the end of a marriage, and I needed help. I found professional coaching actually through the medical school at the University of Kansas, which was my first faculty job after residency. And they began doing life coaching with the medical students. And they did faculty development on this, and I became a coach for the students. And I actually wasn't very good at it at first. It's very hard. And so I decided to pursue coaching as a second career path and became certified, and it changed my life. It opened up possibilities in both my professional career and my personal life. I'm now remarried. I have two little boys. Um, I'm a mother, which is all I've ever wanted to be. And I love my job. I have the best job in the whole world. And I wouldn't have said that 10 years ago.
Well, to be honest, like, how is this different than therapy?
Yeah, that's such a great question. I get that a lot. So, professional coaching, if you think of a stage coach, it is a vehicle to get someone from where they are to where they want to be. And so, what we're doing is provoking the thought and the creativity needed to maximize your potential. We're not fixing people, we're helping them be their best selves. And it's just holding space for them to align their personal and professional goals and values with well being and performance. So, we're really tapping into someone's who. Um, and so, how does that differ from therapy? Therapy is a very past based um, type of event where you talk about past trauma and you're trying to get from dysfunctional to functional. In coaching, we're talking about the present and how we're going to move through the future. So it's really taking the functional to thriving.
Okay, so I think personal coach is different than professional coach, or is there overlap, or how does that work?
Yeah, there's definitely overlap.
Okay.
In the business sector, professional coaching has been a part of, the business model for many, many years and has been shown to be highly successful. And so there is executive type coaching where you focus on goals, etc. Life coaching is very similar, but what I'm doing is working with you through metacognition. So we're thinking about our thinking. And it's really thought based coaching. So we understand what our mind is doing in certain situations. And I feel that that type of coaching then gets you to the goal based coaching very much easier. And so we're emotionally connecting our inner purpose and passion to our outer goals and strategies to bring about sustainable results. And the reason the results are so sustainable is we're doing this metacognition and this tapping in to our emotional who.
So that sounds different than mentorship. Should we have a mentor plus a professional coach, or how could that work?
Yeah, so mentorship, I think, is something we are all so familiar with in the academic world and in the urologic world. And many people consider sometimes mentorship and coaching to be the same thing, but they're very different. So, a mentor is someone that has been there and done that. They've, you know, gone through the training and now they're going to show their mentee the ropes. So, a mentee typically seeks out a mentor, and the mentor basically says, I think you should do this, consider this, and kind of tells them a path forward that may or may not work for them. Coaching is so different. In coaching, when I coach someone, the coachee is the expert in their own life. So I never tell them what to do. My goal is to ask thought provoking questions to allow them to unlock the solutions that they already have, but maybe there's an internal block from keeping them from pursuing those solutions.
Should mentors strive to just be mentors, or should they think more about what the mentee needs, or just because the training isn't there, it's not as productive? What are your thoughts about that?
Yeah, so you know, there's lots of publications that use coach, right? You hear surgical
Yeah.
coaching, we have a coaching program, and really what they're talking about is mentorship usually, because coaching is a whole nother skill set. And I have done so much coach training, and I still find myself sometimes, you know, telling someone what I think. It's not about me. And it's very easy for us as mentors to put ourselves in that person's place because we've been there. So, coaching is a whole nother skill set. And I do think you have to practice and you have to learn the theory. And really, you have to learn to listen. And you want to intuitively listen. I'm listening for what's not being said. And then it's a lot of reflection. It sounds like I'm hearing. And then validating. It's understandable that you feel frustrated. Anyone in this situation would feel that way. We all have emotions, and many times we feel guilty for having them. So it's a lot of reflection, validation, and normalizing the situation and how we can move forward. So, very different than mentorship, but I do think that helps me be a better mentor.
Well, to be honest, it sounds like that takes a lot of time, a lot of time and energy and effort. And I mean, it's hard. All of us are running the fastest we possibly can. Um, Tell me how when you started professional coaching, like how did it transform you? Were you able to step back? How were you able to find joy again? Because a lot of us are kind of on the edge at this point.
Yeah. What coaching did for me, first of all, I made it a priority. My chairman at the University of Kansas at the time was Jeff Holzberline, and he was so supportive of anything I wanted to do. So I was like, I need 4 days off to do this module one of this training program. And he's like, no problem, I'll pay for it. Huge. So without that support, I don't think I would have done that. It was just, he was right there with me and supported me. And so during that first module, we do a lot of tapping into our own wisdom, a lot of value setting, value exploration, what we really want in life. And we look at the future. So, one really helpful exercise that I went through was 1 year from now. And so 1 year from now, I wrote like I was in that scenario, like I am doing this. I am living this. I feel this. I make this much money. I am pregnant. It was so interesting that when I look back at that, what I it was like a fortune telling event. I was like, this all happened in a year. And why it happened, it's not some magical thing. It's because I thought about it and then I made it happen because the power is within me. But a lot of us get into this routine where we're not thinking, we're just going through the motions. And our mindset is very much, I should, I have to. I have to see this many patients today. I should do this many cases. If I don't produce this many RVUs, I'm not worthy. And when we shift our energy into I choose, I want to, and I choose to, it changes our mindset. And then we make different choices. And we become very conscious of what we want in our life. So that's what we're trying to do is increase our consciousness. And it just transformed me. And don't get me wrong, I still fall down the rabbit hole of patient complications and not meeting certain standards at work, a patient, not liking me on my survey. All of those things still are there. I know how to deal with them now.
So, should we consider should we divide ourselves and then have like professional goals that we kind of document so we can work towards it, but then also personal goals? I feel like a lot of us, I mean, honestly, most of us committed our 20s and 30s to train in this field. And so trying to figure out what we like and enjoy is hard because what do we enjoy? We like coming to work.
Yeah.
But did it help you create a better balance?
Yes, so understanding who I was, because I think after our 20s and 30s of training, we look in the mirror and we don't even know who we are anymore. I hired a coach and she gave me a list of 50 pleasurable activities because I couldn't think of anything to do when I got home other than continue to chart and work on my research and go for a run. And she was like, okay. And it was like, go outside and listen to nature, drink a glass of hot tea by a fire, like all of these things, just getting back to the basics. And it was like my hygge, it was like finding, what calmed me down and made me relax. And also identifying my identity. So right now I identify myself as a mother, a partner, a healer, and a life coach.
Do you think that will increase your longevity in the field? I mean, one of the issues we have are major workforce shortages, right? So
Yeah.
people are just burnt out, they're tired. Do you think that that personal, I guess, understanding and knowing yourself allows you to practice longer?
Absolutely. So I will tell you, um, I love my job so much because when I was, recruited to come to this new position, they were like, what do you want? And I said, I want to work clinically part-time. That's all I have. And I want to be able, I'm a prostate surgeon. I do whole up. I want to do prostate surgery. I want to do voiding dysfunction and stones. And I don't, I want to see what I want to see. And they were like, no problem. Because I had a vision for myself. I was like, if you trust me, I will make this work for you. And they did. And the other part of my time, I get to life coach. And so I worked with my department to be like, hey, I offer this great skill. I can do this for the residents, but I'm not going to do it for free. And they pay me to do that. They increase my FTE. And so, but it's because I have a vision of what I want and I'm so passionate about it and I fight for it. And so, yes, I love practicing. I love helping people. I feel so good about what I do. Do I still have frustrations every day with the EMR and my inbox? And of course I do. I look at it in a different way and I'm just more creative because I'm not burnt out. So I can come up with solutions. So I think I'll practice into, I see myself practicing into my 70s because I just love what I do so much. And going to work right now, I have two little babies. It's like a break. I can't wait to go to work. I'm like, see you later, guys. I get to go help people. And it's because I know myself and I feel empowered to fight for what I want. And if someone doesn't, it doesn't work out, like if they're like, that doesn't work for us, fine, I'll go find someone else.
Well, I mean, it seems like you're in a unique position because you were able to one verbalize what you wanted and what you needed, and you're in a center that appreciated and also recognized what service you were providing. yes, you are providing it for the med students and maybe their residents, but you are providing a service for them. So there's less burnout. They can understand mentally how to deal with certain loads and then hopefully stay longer in the profession. Should we be looking for coaches that are in medicine, or can it be anyone? Does everyone understand just what the pressures are for us? Or how do you think about that?
That's such a great question. I get this question a lot. And so, in the coaching world, you do not need someone that understands your circumstances. In fact, when I don't understand what someone is going through, it's actually easier for me to coach because I'm very curious. I'm like, huh, tell me more about that. I will say, though, in healthcare, physicians represent a very different type of career in terms of, the strains on them. And so, I do believe that being a physician makes me a much more legitimate physician's coach because I do understand. I have been there. And I think people believe in what I'm saying more because they can see that success. Um, and so I do think being a physician coach is incredibly important. I don't think it's necessary, but I do believe the market, like that's what the customer wants, is someone that understands their job.
And listen to them. I mean, so I'm from the generation that really said frequently, well, don't be afraid to ask for help, but just know it's a sign of weakness. How do we get over that barrier of just asking for help, that we're not all knowing and that we really should be able to talk it out with someone and figure out what we want?
That is why coaching is so beautiful because what we're doing in coaching is we're leveraging our strengths instead of trying to hide our deficiencies or focus on deficiencies. So it's very strength based. And then we learn how to use our strengths to get better at our weaknesses. And so that's something that's very, very different than surgical training because how often were you, brought into your program director, like, you're not doing this well, we need you to work on this. Coaching is so different and it actually unlocks your confidence and your power to be able to then use the strengths to work on deficiencies. So asking for help feels very easy for me. I always say I focus a lot on how we thrive at work. One thing is never worry alone. Never worry alone. So when we tend to become consumed with maybe a complication or something that's happening, we isolate. That's very human. That's what our brains do. And what we really want to try and tap into is that sense of community and that never worry alone. Talk to someone, ask for help. And I do think coaching is a great tool to help us utilize our resources.
Well, a lot of the conversation's been about just like understanding yourself, understanding your feelings, finding your motivation, but we're surgeons. So we're very like data conscious. What is the data behind professional coaching? Is there data?
Yeah, that's a great question. So I have been so fortunate when I moved to Colorado to find two other physician coaches that are internal medicine docs. They created a program called Better Together Physician Coaching. And I joined that group with them, and we have done a randomized control trial across the nation where we enrolled over 1,000 residents in professional coaching and randomized them to our 4-month online curriculum versus their well-being as part of their GME. And then we did a crossover 4 months later. They did the Maslow Burnout Index before and after coaching, and we showed a significant decrease in burnout with coaching in all 3 indexes of the MBI. We also did some qualitative analyses of like, why does this work? And so we came up with several themes. One of them was this metacognition, learning to think about your thinking. So what really they're learning to do is coach themselves. through hard times, which is so important in residency. They also loved the sense of community. So we held 2 online group coaching sessions a week for an hour where people would come up anonymously and get coached in front of everyone. And what they loved was seeing other people have the same issues that they did. There are a lot of universal concepts that we would coach on. And then they loved the asynchronous model of our online coaching. They could come to a group call, they could ask for one-on-one coaching and we'd meet them online. They could do a workbook. And it was just amazing, the results that we found. And we've expanded the curriculum to faculty, APPs, and medical students across the country.
That's amazing. I really feel that you're saying that if you can be a little bit vulnerable, if you can ask to talk to someone, to not suffer alone, you can work through a lot, and you can really create like a plan or a path for your life outside of your profession, just for your life. And I think that first step is challenging, but I really appreciate you. I mean, I guess you were kind of forced to do something because you were in a predicament where you're like, I have to do something. I have to
Yeah.
survive. And you were able to kind of reach out and figure it out. So I really appreciate you sharing.
Thank you. My one regret,
Uh-huh.
well, maybe there are a lot, but this is really, one that I will verbalize. I wish I didn't have to have a traumatic experience to find myself, to find coaching, to create the life I want. And so, really, what I'm doing when I'm coaching residents, I'm giving them a gift that I wish I would have had when I was a resident. My coping mechanisms were all wrong. I just worked harder. The harder things got, the more I worked. The just put your head in the sand and go. And you're just like, get through it, it'll get better. And it just doesn't. It doesn't. It's the arrival fallacy. We're never going to be happy. Happiness is within, and we have to learn how to tap into that. And so I really do feel like I'm giving myself a gift by helping residents.
Oh, thank you. Is there anything else you want to share with our audience?
Yes, if you would like to talk more about professional coaching, Kerri Thurmon, Kerri.Thurmon@cuanschutz.edu is my professional email. I am always open for coaching. I am willing to hook you up with another professional coach. I know many. We are really trying to infiltrate our services through the healthcare field. And so I'm always here for you to create an open space without judgment where I just show you your mind.
Would you also be open to, if someone wanted to build a program at another center or in private practice, also having that conversation?
Absolutely. How do I get started?
Okay, well, that sounds great. Well, thank you very much, Dr. Thurmon, for sharing your time and expertise with us today.
Thank you so much.
And thank you to our audience for joining us on the AUA Leadership in Business podcast. Until next time, continue to learn, lead, and excel. Thank you.
Thank you for listening. If you enjoyed this episode, make AUA Leadership in Business your go-to podcast. Subscribe today by searching AUA Leadership in Business on your favorite podcast app and enhance your leadership and business education needs.